We will continue the training on Netsmart Endeavor for the skilled clinicians, RNs, and LPNs in order to ensure proper skilled clinician documentation and effective documentation. On page 7, the focus is on equipments, cleaning and maintaining those equipments, and you have to document that you acknowledge that the equipments are there and then that you are maintaining them properly, you are cleaning them for infection control measures. You are sanitizing them, you are restocking, and you also have to put your time. Okay, when you perform those services for the client. And the focus on here is also for your documentation as a clinician, your documentation, your notes, your SN notes have to be at least every 2 hours during your shift. At least a documentation and SN note is required at least every 2 hours during your shift. And then in terms of maintaining and cleaning the equipment that are in the home for the client, as you are maintaining and cleaning those equipment on the days and the times during your visit and during your shift, in order to acknowledge that, you have to put your times. Okay, you have to put a time that you did change and you did clean. So anyone who is reviewing your chart or wherever your chart may find itself, it will be clear that you not only acknowledge that you were able to implement those services for the client. Okay. You kept the patient area clean, you restock your supplies. Okay, and the care that you provided, you are changing your oxygen tubings, you are changing tubings, you are changing the bags that are in the home, you are doing all of that. You are restocking the necessary supplies that need to be restocked. This is very important that you document this, because if you don't document it, it was not done. You didn't provide that care for the client. Okay. And some of those tubings, you know, they have to be changed, and some of the bags, they have to be changed within 12 to 24 hours, and some of them within 48 hours. And some of them, you have to change them once a week, like, or when needed. Okay. You have to document your time and which visit that you perform those services for the client. If you don't document this, that's me, it was not done. And it has to be done. Somebody has to do it. Okay. So this is very important that you document in this section here, that you are maintaining and you are cleaning the equipments that are in the home, and you are keeping the patient area clean, and you are restocking the supplies that needs to be restocked. You are changing your bags, you are changing your tubings, and then you have to document the time. And then your narrative notes, as you begin your shift, Let's say if your shift start at 8 a.m. Let's say if your shift start at 8 a.m., you can write, you know, a simple note, how you found the patient, how you found the patient and things like that. Like you can write upon arrival to the client's home, skilled nurse greeted client's family, and client was found in whatever condition, and then you can document anything you want. It can be a very simple note. Upon your arrival to the home, you don't have to do it as you arrive because you're gonna start performing the services that need to be provided. Your attention at that time is your focus is gonna be on the patient. Your focus is gonna be on the client. If your shift start at 8 a.m., you can start your documentation after your attention was with the client. When you have time, when it is inappropriate or proper time, you can start your documentation, acknowledging, indicating that you did arrive in the home at 8 a.m. and it can be a simple note. And then your second note, you can write your second note 2 hours later. Okay, which is at like 10 a.m. You can write your second note. Okay. You can write your second note. Or you can even make this from 8. You can make it 8:30. And you can write your second note 2 hours later. No, whichever time. Just make sure you do it at least every 2 hours. And then you can do an SN note at any time if there are any changes in the medical condition of the client. You can do an SN note at any time. At least there has to be a note on the chart at least every 2 hours. However, you can write a note at any time. If there's any medical condition changes, you should write a note. You don't have to wait for 2 hours, just, use your clinical skills. Okay. Use your clinical skill. Your second note at least has to be a very detailed summary of the client's condition and the care that you provided, the treatments that you provided. By the time you do your second note, it has to be very detailed. It has to be very detailed because you're doing a summary from page 1, the things that you documented from page 1 to 7. Now you are putting everything in a summary. Because on some charts, I'm only seeing that some clinicians are writing just a line here, just a line. And they're just writing a line and they're not really saying anything. The line that they are writing is not really saying anything in terms of a summary. Okay. You have to do a very detailed summary, at least, like a paragraph or two. Like, a good paragraph, like 2 paragraphs, 2 to 3 paragraphs. Just summarize everything. How the patient is doing, the patient's condition, the treatments and the care that you provided to show that the patient is making progress, patient's condition has improved, the patient is doing well. And if not, you have to also document that to reflect how the patient is doing and your implementations, your interventions. Okay, and if you are setting any goals for the client, you can also write that as well. That the goals that you are setting, and are those goals effective? Are we meeting the client's needs? Are the client needs being met? We also have to meet their needs and make sure that the goals that we have set are realistic goals, and the clients are meeting those goals, and the goals are effective. You have to reflect that in your note. You have to reflect that in your note. The client is doing well, they're making progress, their medical condition is improving, how they are doing, things like that. A good summary note. Then if you do about 2 to 3 paragraphs, by the time you do your second note, then every note that you do afterwards can be a simple note, like a line, or, a line, or a line or two. However, we have to have at least a detailed summary note with great details. If anybody picks your chart, picks up your chart, an auditor or anyone, a physician, they are able to read that summary note, that great and very detailed summary note. It gives them a picture of a general picture of how the client is doing. Okay? When you write, okay, let's see. I'm not really gonna write a note. I'm just gonna do this. Sometimes I look at a chart and all I see is this, like a line. I'm just doing this because I'm not really writing. I'm not really writing. Okay. So that will not be enough. It has to be a paragraph. Okay. And one line is not enough. It has to be a very detailed paragraph. And if you have any questions, you can give me a call, or it's better if you send me a text message. It's better if you send me a text, and I will respond and answer any of your questions, and then save your notes in order to save your work, the good work that you are doing. And I thank you for your time. I don't know where.